Hey Warriors, welcome back to Empowerment and Illness. I'm Gwen, your host, and I'm glad you're here. If you live with lupus, you probably know this routine. You go to the doctor, they hand you an order for blood work, and before you know it, you're sitting in a chair watching somebody fill tube after tube after tube with your blood. Then maybe they hand you a cup because apparently the blood wasn't enough. We need the urine too. A few days later, the results start showing up in your patient portal: CBC, CMP, C3, C4, anti-dsDNA. Then there are numbers highlighted in red with high or low beside them. And suddenly, you're staring at your phone thinking, okay, what does that mean? So what do? We immediately go to Dr. Google looking for an explanation. And somehow, we end up even more confused than when we started. I think a lot of us have been there. We know our doctors are ordering these tests for a reason, but how often do we actually know what they're looking for? I don't want us diagnosing ourselves from our lab results, and I'm definitely not going to sit here and pretend I'm a rheumatologist. For this conversation, we're going to rely on information from the medical experts who diagnose, treat, and study lupus and the complications that can come with it. My job is simply to help us understand that information in a way that makes sense when we're sitting on the other side of that lab order. Because there's a difference between seeing a number on a screen and understanding why your doctor is paying attention to it. Some tests may help our doctors look for signs of inflammation or immune activity. Others can help to monitor our blood cells, kidneys, liver, or how our bodies may be responding to treatment. And sometimes what matters isn't one result from one Tuesday morning. Our doctors may be looking at how those results fit our symptoms, our medical history, other test results, and what has been happening over time. So today, we're going to take some of that alphabet soup and make sense of it. What are some of these common tests? Why might our doctors order them? And when those results come back, what questions should we be asking instead of immediately heading to Google because something showed up in red? Let's talk about it. After our visit with the doctor, where we've talked about everything that's happened medically since our last visit, it's time for blood work. Because we're involved in our own care, we've told our doctor what's been working, what hasn't been working, and some of the challenges we've encountered since the last time we sat in that office. Our doctors listen, ask questions, and decides it's time to see what else is happening. So here comes the order for blood work and urine. And you're thinking, do I have to see the vampires today? You and your doctor laugh, and then he says, don't forget about the urine too. Oh, well now, I'm being drug tested too? And if you have that kind of relationship with your doctor, you can joke around like that and keep things lighthearted. I find that having a sense of humor during some of these moments can help ease the anxiety. We're dealing with enough serious things. Sometimes it's okay to laugh while we're doing it. Then we look down at the lab order, and there they are, the alphabets. Now, most of us aren't looking at that form thinking, wonderful, a CBC. I've been looking forward to this all week. And that's where I want to start. Because our doctors didn't randomly check boxes on that form. Each test can provide a different piece of information about what's happening inside our bodies. Some may look at our blood work. Some may look at our blood cells. Some may help our doctors monitor our kidneys or liver. Some may give our doctor information that can be helpful when evaluating lupus activity. And the urine sample that we were just joking about can provide important information too. But here's something the medical experts make very clear. There isn't one blood test that tells our doctors everything they need to know about lupus. Our doctor has to put different pieces of information together. What we've told them during our appointment is one piece. Our physical examination may provide another. Our medical history matters. Our medication matters. And these lab results add more information to that picture. So instead of looking at that lab order as a bunch of letters we don't understand, we're going to find out what some of these letters actually mean. Let's start with the one we see all the time, CBC. What are they looking for? CBC stands for Complete Blood Count. Okay, that tells us what the letters mean, but it still doesn't answer our question. What is our doctor actually looking for? A CBC gives our doctor information about what's happening with our blood. It looks at things like our red blood cells, white blood cells, and platelets. We don't need to memorize all the numbers or learn the medical terminology behind them. What we need to understand is that those numbers can give our doctors clues about what's happening in our body. We just sat in the doctor's office and talked about how we've been feeling. Maybe we told our doctor, I've been more tired than usual lately. We know fatigue can come with lupus, but our doctor doesn't necessarily want to assume lupus is the reason. The CBC may show signs of anemia, which could be another reason we're feeling tired. Maybe we've been getting sick more often, or our doctor wants to make sure the medications we're taking aren't affecting our blood counts. Our white blood cells can provide information about how our immune system is doing and whether something needs a closer look. Then there are platelets. These help our blood clot. If those numbers are too low or too high, that's information our doctor may need to investigate further. And that's really what I want us to understand about the CBC. It's giving our doctor clues. So when we see CBC on that lab order, we don't need to think, I have no idea what any of this means. Now we know. Complete blood count. Our doctor is taking a look at what's happening with our blood and checking for clues that may help explain what's happening with us. Okay, vampires, there's your first tube. Now let's look at the next set of letters on that order. CMP, which stands for Comprehensive Metabolic Panel. Now, comprehensive sounds like they're getting ready to inspect everything we own. But this test gives our doctor information about several important areas of our health, including how our kidneys and liver are functioning, as well as things like our blood sugar, protein, and electrolytes. For those of us living with lupus, the kidney information is especially important because lupus can sometimes affect the kidneys. And here's the tricky part. We may not necessarily feel something happening with our kidneys in the early stages. That's one reason our doctors may watch those numbers even when we're not complaining about anything that sounds kidney related. The liver information matters too. Our doctor may want to monitor how our liver is functioning, especially because some of the medications we take can affect it. Again, we're not expected to look at those numbers and figure out for ourselves whether our liver or kidneys are okay. That's our doctor's job. What we can do is understand why they're looking. So, if we've told our doctors about changes in how we're feeling, the CMP gives them another set of clues. Because they may have results from our previous visit, they can also look at whether something has changed over time. That's the part I think we sometimes miss when we open the patient's portal. We see today's numbers. Our doctor may be looking at the story those numbers have been telling over several visits. So now we've given the vampires another tube. The CBC gave our doctors information about our blood. The CMP gave them information about how some important systems in our bodies are functioning. We now have another tube to complete, C3 and C4. Now we get to two of those lab results that really look like somebody just started naming things with letters and numbers. C3 and C4. C3 and C4 are proteins that are part of something called the complement system, which helped our immune system do its job. That's about as deep into the science as we're going today. What we really want to know is why rheumatologists keep checking them. For some people with lupus, C3 and C4 levels can drop when lupus becomes more active. So our doctor may look at those numbers as another clue about what our immune system is doing. And this is where a conversation with the doctor matters again. Maybe we've said something has changed. I'm more tired. My joints are hurting more. I'm noticing symptoms I haven't had in a while. Our doctor may look at our C3 and C4 results along with what we've told them and the rest of our lab work to help understand what's happening. But C3 and C4 aren't a lupus crystal ball. A low number doesn't tell us by itself that we're having a flare. And a normal number doesn't mean we should ignore what our body is telling us. These are pieces of information our doctor interprets with everything else. So when we see C3 and C4 in our patient's portal, we don't have to stare at them thinking, what in the Sesame Street is this? Now we know why our doctor may be watching them. And there may be another lupus-related test sitting beside them on that lab order. Anti-dsDNA. Anti-dsDNA stands for anti-double-stranded DNA antibodies. That's a mouthful. And unless somebody is giving us extra credit, we don't need to memorize it. What we really need to know is where our doctor may be checking it. This test looks for a certain type of antibody that is commonly associated with lupus. For some people who have lupus, changes in anti-dsDNA levels can give the doctor another clue about whether the disease may be becoming more active. Doctors may pay particular attention to it when they're concerned about lupus affecting the kidneys. But just like C3 and C4, this number doesn't get to tell the whole story by itself. Some people with lupus don't have anti-dsDNA antibodies at all, and having a change in the result doesn't automatically tell us exactly what's happening. Our doctor considers it alongside our symptoms, physical examination, other lab results, and what has been happening with us over time. So if we've been telling our doctor something feels different, they now have several places to look for clues. What are we experiencing? What are our blood counts showing? What are C3 and C4 doing? What does anti-dsDNA show? Is something changing compared with our previous results? They're putting the picture together. And that's why I don't want us opening our patient portal, seeing one result highlighted in red and immediately deciding we know what it means. We know enough now to understand what our doctors may be looking for, but interpreting what the result means specifically for us belongs in the conversation with our healthcare team. We've dealt with the alphabet, but remember that cup the doctor told us not to forget? Yeah, it's time to talk about the urine. What are they looking for in our urine? When our doctor orders a urinalysis, they're looking at our urine for clues about what's happening inside our bodies. And for those of us living with lupus, one of the most important things they're watching is our kidneys. Lupus can sometimes affect the kidneys, and we may not have obvious symptoms when that starts happening. That's why that little cup can provide some pretty important information. Our doctor may look for things that shouldn't be showing up in our urine, particularly protein or blood. If protein is showing up, especially if it continues to show up, our doctor may want to investigate why it's there and whether our kidneys are filtering the way they should. Blood in the urine can also give the doctors a reason to take a closer look. Sometimes the doctor may order another urine test that looks more specifically at how much protein we're losing. Again, we don't need to learn how to calculate any of this. We just need to understand what they're looking for and why. Finding something abnormal in our urine doesn't automatically mean lupus is affecting our kidneys. There can be other reasons for abnormal results. That's why our doctors look at the urine results along with our blood work and everything else. So that cup wasn't a drug test after all. Our doctor was gathering another piece of information that blood work alone may not provide. And now we've made it through quite a few of those alphabets on the lab order. But there's one part of this process that can cause anxiety before we've even had a chance to talk with our doctors. We open up that patient portal and there it is. Red, high, low. And suddenly we're diagnosing ourselves before the doctor has even had breakfast. Let's talk about what these flags actually mean. We open the patient's portal, look at our results, and our hearts skip a beat. There it is, red, or maybe it says high or low. And immediately we're thinking, okay, what's wrong with me now? Before we let that red number ruin the rest of our day, let's understand what we're actually looking at. Labs use something called a reference range. That's the range the laboratory uses to help identify results that fall within or outside expected values. So when our numbers fall outside that range, the system may automatically flag it. But that flag isn't sitting there saying, Gwen, panic immediately. It's pointing out a result that may need to be interpreted. And this is where I think knowing just enough about our lab works can actually help us. We now know what some of these tests are looking for, but we also need to know where our jobs stop. We don't want to look at one high or low numbers and decide for ourselves what it means. Our doctor may be looking at whether that number is slightly outside the range or significantly outside it. They may compare it with our previous results. Sometimes a result that looks scary to us may not concern our doctor very much. Other times, a change that doesn't look dramatic to us may get their attention because they know what our previous numbers look like. That's why trends matter. Instead of only asking, is my number high or low, we can start asking, is this different for me? Maybe our C3 has been around the same level for several visits, and now it's changed. Maybe something in our CBC has slowly been moving in one direction. Maybe protein has started appearing in our urine when it wasn't there before. Now we're looking at our results differently. We're not trying to interpret them ourselves. We're becoming familiar enough with our own information to have a better conversation with our doctor. And if something in that portal concerns us, we can ask, I noticed this result was flagged. What does that mean for me? Has this changed since my last blood work? Is there anything here you want us to keep watching? Those are questions we can take back to our healthcare team, because the goal of understanding the alphabets of lupus isn't to turn ourselves into doctors. It's to make sure that when our doctor starts talking about our lab results, we understand the conversation we're already part of. Set aside some quiet time this week with your journal. These prompts are meant to help you notice your direction, not judge your pace. As you reflect on today's episode, ask yourself, when I receive lab results, do I usually understand what my doctor's looking for, or do I simply wait to hear whether everything is okay? Have I ever seen a high or low result that becomes worried before I had a chance to discuss it with my doctor? What is one lab test that I now understand better after today's conversation? For our listeners' action plan, this week we're asking you to take 3 practical steps to become more familiar with the lab work your doctor orders. Step 1. The next time your doctor orders blood work or urine testing, look at the order before you leave. Pick one test you don't recognize and ask, what are you looking for with this test? Step 2. When your results come back, look at them without trying to diagnose yourself. If something is marked high or low, write down the results and the questions you want to ask your doctor about it. Step 3. Compare one current result with the previous result. You're not trying to interpret the numbers yourself. You're simply becoming familiar with your own information so you can ask, has this changed and does that change matter for me? And now, a word from our sponsor. Today's episode is sponsored by Empowerment in Illness. We spent today talking about understanding the lab work our doctors order, but understanding the information is only part of it. We also need a way to keep track of what we're learning along the way. Empowered from the Start, Finding Your Footing After a Lupus Diagnosis is a guided workbook designed to help you begin understanding and navigating life after a lupus diagnosis. It gives you a place to work through some of the questions that come up with learning how to live with this condition. And the paper trail helps you organize the information you're collecting along the way. Your medications, symptoms, appointments, questions, lab information, and other pieces of your healthcare journey have a place to live, so you're not trying to remember everything when it's time to talk with your healthcare team. You can find Empowered from the Start and the paper trail through the Empowerment in Illness link tree. Just click the link in our episode summary. Be prepared. Don't panic. And now, back to the show. Before we leave, I would like to close with a special portion of the show I call Healing Heartbeats. This is where we allow ourselves to wallow in sorrow. Please give yourself 3 minutes to laugh, cry, scream, cuss, or just sit in silence. Whatever you need to do to feel it, do it. Let the depression in for only 3 minutes. Once you've reached 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When we hear about the passing of someone, they have the day they were born and the day they pass away. There is a dash in the middle. It's not a long line, but a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let your condition stop you. Today we took some of the mystery out of those alphabets we see every time our doctor orders lab work. And my hope is that the next time you see CBC, CMP, C3, C4, anti-dsDNA, or that little cup waiting for you at the lab, you have a better understanding of why your doctor may be asking for them. You don't need to memorize every number or understand every medical term. That's not our job. But we can understand enough to participate in the conversation. We can ask what our doctors are looking for. We can ask whether something has changed. We can ask what a result means for us instead of sitting quietly because we don't understand the language. Those lab results aren't just numbers sitting in a patient portal. They're information about us. And when we combine that information with what we know about our bodies and the expertise of our healthcare team, we can make better informed decisions about our care. Don't be intimidated by the alphabets. The next time somebody ties that rubber band around your arm and starts lining up those tubes, we'll have a better idea of why we're giving away half of our blood supply. Learn what they're looking for. Ask questions. Stay informed. Because nobody's asking you to become the doctor. We're asking you to become an informed decision maker in your own healthcare. Remember, you have the strength, the heart, and the support to continue your journey. Be safe.